Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, Cystadenoma. Right, Cystadenoma is mostly an intrahepatic tumor which is seen in almost 83% of cases. Cystadenoma is intrahepatic and it occurs in extrahepatic duct or common bile duct. Because this is a cystadenoma, it occurs within extrahepatic bile duct or it can occur in the gallbladder. This cystadenoma is most commonly involves the right lobe of the liver, which is seen in almost 50% of the cases. Then this cystadenoma with mesenchymal stroma. If there is cystadenoma with a mesenchymal stroma, it is exclusively seen in younger women and in middle-aged women. Cystadenoma with mesenchymal stroma is exclusively seen in younger and middle-aged women. So what is a cystadenoma? As the name says, in the pathology, you will see presence of a cyst is seen. Right, you will see that. So in the cystadenoma, you will see a cyst that has globular external surface with multiple protruding cysts or locules are seen of various sizes like this. So this is what we see in cystadenoma. And here in this cystadenoma of the liver, the fluid content is mainly mucinous and also it is mainly lined by the columnar epithelium with papillary infoldings are also seen. It is lined by columnar epithelium and papillary infoldings are also seen. So if we revise this diagram, we can say that this is a big cyst and in the cyst we have many small cysts are seen with lobules and they have each cyst or it has a papillary infolding and it is lined by a columnar epithelium. Okay, next, clinical features. The patient with cystadenoma A patient with cystadenoma, mainly he presents with large cystic mass which is around 10 to 20 centimeters in size. And as it is already said, it is exclusively present in, it is seen in women, it is more commonly affects in women and it also occurs after the 40 years of age. In majority of patients, you will see that there is a history of abdominal pain and history of abdominal mass is common in majority of patients. Then we have diagnosis of cystadenoma. So in the diagnosis of cystadenoma, we can do an ultrasonography. In the ultrasonography, you will see that there is a cystic structure is seen. If you do an ultrasonography, you will see that there is a cystic structure will be seen with varying thickness, nodularities and septations are seen and fluid filled locules are seen on ultrasonography. Then you can do a contrast enhanced CT scan, and when you do a contrast enhanced CT scan, you will see that there is enhancement of the cyst wall and the septa. The cyst wall completely, this cyst wall is enhanced and even the septa which are there, they are also enhanced on contrast enhanced CT scan. Then, because this can occur in extrahepatic bile ducts also, you can do ERCP. In the ERCP, endoscopic resection of, sorry, endoscopic retrograde cholangiopancreaticography. Here you will see that the intrahepatic bile ducts are mainly displaced by the tumor and you will see that there is no communication is seen between the biliary tree and the cystadenoma. Cystadenoma is separate and biliary tree is separate. No communication is seen on endoscopic retrograde cholangiopancreaticography. Then treatment of cystadenoma. In the cystadenoma, the main treatment is enucleation is done. So in the cystadenoma, the main treatment which is done is enucleation is done. So in the enucleation is done, it is done for neoplastic cysts with no signs of malignancy. If there are no signs of malignancy, then you can do a enucleation is sufficient if there is no signs of malignancy. But if there are any signs of malignancy, then we should do a formal hepatic resection is done if there are any signs of malignancy. If there are any signs of malignancy, then a formal hepatic resection is done.
Thank you and thank you for watching.